When people in their 60s, 70s, or 80s step into a doctor's office, they often believe they're receiving the same level of care and respect as anyone else. But the reality is more complicated. Many older patients are shocked to learn that what doctors really think about seniors is not always flattering. Some truths are hidden behind polite smiles, prescription pads, and rushed visits. And while most doctors truly care, the healthcare system itself sometimes sends silent messages that seniors aren't always prioritized the way they should be. To uncover this reality, let's step into the shoes of different people, grandparents, sons, daughters, doctors, and nurses, and listen to their stories. Because in these stories lie 5 ugly truths every senior needs to know for better health. The story begins. Meet James and Martha. James Whitaker was 76 years old, a retired school principal living in Ohio. His wife, Martha, was 74, a kind woman who baked cookies for the neighborhood kids and knitted sweaters every winter. Together, they had lived through wars, recessions, the birth of the internet, and the raising of 3 children. But now, as the years added up, so did the doctor visits. Martha had arthritis, James had high blood pressure, and both had their fair share of medications neatly arranged in pill organizers on the kitchen counter. One morning, James sighed as he folded a letter from his doctor's office. "They scheduled me for another follow-up, Martha," he said, rubbing his temples. "I feel like I'm just a number in their system." Martha glanced at him thoughtfully. "James, don't take it personally. But sometimes I wonder too, what do doctors really think when an old person like me walks in?" Neither of them knew it yet, but they were about to discover 5 harsh truths that seniors rarely hear out loud. Ugly truth number 1. Doctors often see seniors as complicated cases. Dr. Karen Mitchell, a 42-year-old physician, had been practicing family medicine in Cleveland for nearly 2 decades. She had patients of all ages, children, young adults, and seniors. When James walked into her office, she greeted him warmly, but inside her mind she sighed. She never admitted it out loud, but elderly patients were often the most difficult. They came with multiple prescriptions, a dozen medical conditions, and long stories about aches, pains, and symptoms. Appointments that should last 15 minutes stretched into 45. "James," she said with a smile, "how have you been since our last visit?" James chuckled dryly. "Doctor, at my age, if I wake up and nothing hurts, I assume I'm dead." Dr. Mitchell smiled politely, but behind her professional mask, she thought about the growing pile of charts waiting on her desk. The truth was, many doctors quietly feel that seniors are too complex, and, because of that, they sometimes get rushed care. Ugly truth number 2. Ageism exists in medicine, even if doctors deny it. Martha noticed something unsettling during her visits. When her daughter, Susan, who was 45, visited the same clinic for back pain, the doctor leaned forward, listened carefully, and offered several modern treatment options. But when Martha mentioned her stiff knees, the doctor often shrugged. "That's normal at your age," she would hear. One day, frustrated, Martha asked bluntly, "Doctor, are you saying my pain doesn't matter just because I'm 74? The room went quiet. Dr. Mitchell quickly reassured her. "Of course your pain matters. I only meant that arthritis is common in seniors." But the truth was there, lingering unspoken. Many seniors are unconsciously treated as if their suffering is expected and less urgent. It wasn't malicious, it was systemic ageism, something that crept into the culture of medicine. Ugly truth number 3. Doctors secretly worry about seniors following instructions. At a medical conference in Chicago, Dr. Mitchell sat with colleagues over coffee. The topic turned to elderly patients. Dr. Harris, a cardiologist, sighed. "I prescribe medications, but half my older patients forget to take them, or they mix them up. Sometimes, I honestly don't know if they're even following what I say." Another doctor added, "I've had seniors nod along during visits, but later their kids call saying Mom didn't understand a word I explained." It was harsh, but it was reality. Doctors worried that seniors might struggle with memory, hearing, or simply the overwhelming complexity of medical instructions. And while some seniors like James were sharp and organized, Others found themselves lost in the maze of pills and appointments. Martha experienced this firsthand when she accidentally took her evening pill twice in one night. She laughed it off, but James didn't. He knew mistakes like that could be dangerous. Ugly truth number 4. Time pressures mean seniors sometimes get rushed. At the clinic, James often noticed the hurried pace. Doctors rarely looked up from their computer screens, typing as he spoke. One afternoon, he asked Dr. Mitchell, "Do you ever feel like you're too busy to really listen to us?" She hesitated, then admitted softly, "James, I want to give every patient the time they deserve. But insurance systems, schedules, and paperwork make it hard. Seniors, especially, need longer conversations, and sometimes I just don't have enough minutes in the day." The truth stung. Older patients who needed the most time often got the least. It wasn't the doctor's fault, it was the system's fault. But to James and Martha, it still felt personal. Ugly truth number 5. Many doctors assume seniors don't want aggressive treatments. When Martha was diagnosed with a heart condition, Dr. Mitchell presented 2 options: a conservative plan of medication or a more aggressive treatment that involved a small surgical procedure. But instead of fully explaining both, Dr. Mitchell leaned toward the conservative plan. "At your age, Martha, maybe we should just keep things simple." Martha frowned. "At my age? I still want to live, doctor. I still want choices." It shocked her to realize that some doctors assumed seniors wouldn't want, or couldn't handle, advanced treatments. It wasn't always intentional, but it robbed patients of agency over their own health. The turning point: speaking up. One day, James and Martha sat with their children, Susan, David, and Claire, at the dinner table. They shared their frustrations. "I feel invisible at the doctor's office," Martha admitted. "Like they expect me to just endure pain because I'm old." David, who worked in healthcare administration, leaned forward. "Mom, Dad, you have to speak up. Ask questions. Demand second opinions. Don't let age make you silent." Those words sparked something. At their next appointments, both James and Martha took notes, asked direct questions, and refused to accept dismissive answers. To their surprise, their doctors responded with more respect. The bigger picture. The Whitaker story is not unique. Across America, millions of seniors quietly face the same challenges: rushed visits, unconscious bias, complicated instructions, and limited treatment discussions. But knowledge is power. By knowing these 5 ugly truths, seniors can take charge. Recognize that complexity doesn't mean invisibility. Push back against subtle ageism. Bring a notebook or a family member to appointments. Demand the time and explanations they deserve. Ask for all treatment options, not just the simplest ones. Doctors are human too. They juggle pressure, stress, and